Hey guys, we're back with another video, and today we're going to talk to you guys about patient rights. And as you know, I'm Brandy B, the community MP.
And I'm Brandy G, the community MP.
Okay, B. So what do we want our patients in this population to know?
That they have rights. As a patient, you do have rights.
Okay.
So I guess I'll start it off. The first right that we're going to talk about. All right. So as a patient, you have the right to informed consent, which means that you have the right to know what type of treatment you're receiving.
Mm-hmm.
You also have the right to know if any harm was done to you during that treatment.
Yes.
You have an example for us, B?
Yeah. So like if you say you went and had surgery, you know, like you're not going to know what all took place because you'll be asleep. But if something, whenever you wake up, you have the right to know how the procedure went, if there was any complications. So yeah, basically you have the right to know about the whole procedure.
Okay. And also as a patient, you have the right to refuse treatment.
Mm-hmm.
If you think that the treatment is not in your best interest, you have the right to refuse it.
Yeah.
But you have to know, as a primary care provider, we have the right to refuse treatment to patients and we think it's going to harm the patient.
Right. Yeah. So using surgery as another example, although it applies to everything, you know, like if you think that you want to have a surgery and we're like, based on the knowledge that we have, we don't think that you would be a good candidate,
Yes.
or we think that it would be more harmful to you than beneficial, then we have the right as primary care providers to say, we don't think this would be a good idea for you.
Yep. Okay.
And you can always go and get second opinions.
Yes. That's one of their rights.
Yep.
You have the right to second opinion.
Third, fourth, fifth.
Yes. As many as they
opinions
want.
as you want.
Okay.
Yep. So, and then also, you know, in emergency situations, you have the right to be treated. So if you go to the emergency room, they have to stabilize you. You have to be seen. They can't just say, no, I'm not going to see you. You have the right to be treated and stabilized. Although, you know, different hospitals have different definitions of what being stabilized is. So, you know, just figure out what hospital in your area is good that you like, so that if you have an emergency situation, then you can go to that particular hospital.
And as far as the emergency situation, regardless if you are uninsured,
Mm-hmm.
Medicaid, Medicare, or private insurance, they still have the right to be seen, correct?
Right, yeah.
Okay.
And one thing that we were talking about earlier was, you know, like if you have an emergency situation and the ambulance has to come and see you, how does it go? Be like they take you to the closest
hospital so that you can be stabilized. That's
right,
that they want to stabilize. So they're going to take you to the nearest hospital that can stabilize you. Sometimes some hospitals are on diversion where they can't accept any more patients, so they'll take you to the next closest hospital that can stabilize you. Yeah. Okay. Confidentiality. So as a patient, you have the right to confidentiality of your medical care. So you can choose who you want to know about your medical care or medical history.
Right.
So we know as primary care providers that we only share the information with people who need to know the information.
Right. Yeah.
Someone who's working with us on our team to take care of that patient.
Yeah. And then also that goes for people outside of the medical field. Like they don't have a right to your information. We can't just tell them, you know, they call and they're like, oh, hey, my friend goes there. Can I get their patient records? I'm going to pick them up for them. No, we're not going to let that happen. Unless you sign the paper saying that this person has the right to your medical information.
So I had a patient who called me because they needed a work excuse, and they wanted to know would their job be able to call to see exactly what I treated them for that day. So I told them no. So I told the work excuse was enough, and I didn't put what the diagnosis was on the work excuse for that patient.
Yeah, because your job does not have a right to know your medical information. They have a right to know, you know, if you came to the doctor or not, but we can't tell them what you were treated for unless you want us to.
Yes. Okay. Also, as a patient, you have the right to continuity of care. So when I say continuity of care, what do you think that means, B?
Just the relationship that you have with certain providers. So like, say we refer you to somebody and you know, you don't really have you don't build a good rapport with them. Yes. You have the right to say, I don't want to go back to them. You can let your primary care provider know, hey, I didn't like that person for whatever reason, and I want to see somebody else.
Okay. Also with us. So if a patient does not vibe with us, or we don't get a good rapport,
which is rare.
That is rare. But they have the right to say, I want a different primary care provider.
Right.
And therefore, we have to release their care to another primary care provider. Mm-hmm. Transfer their care off. So
right.
You do have that right.
Yes.
Okay. Okay.
Good.
And also one of the things, patients also have the right to get continuity of care once they leave your office. So example of that can be a diabetic patient. Mm-hmm. We can diagnose them with diabetes, but we need to make sure that we educate them on their medications, lifestyle changes, diet, exercise. Yeah. So we got to make sure that we not only just give them medications, but educate them on those things that we're giving them. Yeah. So that's your right to be informed.
Yeah, you have the right to know how to take care of yourself outside of the clinic. So yeah, and we just want you guys to know that like you have the right to choose basically anything with your health. Where you go, who you see, how often you see them. Now we're not saying be non-compliant, but
no,
know your rights.
Know your rights. Know your rights. Because a lot of times I hear patients say, "Well, I have to, I got to, I don't want to, but my doctor say I have to." You have rights. Yeah. So sometimes you don't have to.
You don't.
Okay. No. So we just wanted you guys to know that you do have rights as patients.
And I remember when my grandma, she had got diagnosed with cancer, and I remember her telling me, "I'm gonna do everything I can because my doctor told me to, and so I got to do what my doctor says." And I'm like, well, he probably meant well, but you get to choose. You get to choose how extensive the treatment is with your cancer.
Yes. That's a good example. A good example. Okay. Well, I think that was a really good, short, sweet video on patient rights.
Yeah.
And we'll see you guys next week.
Yeah. So in November, we're starting to talk about diabetes. I think we might have mentioned that in this video, but it's National Diabetes Month next month. So we'll be going over lots of details on diabetes, what it is, how to manage it. So I hope you guys stay tuned for that.
It's going to be a series of videos. Yeah. With diabetes.
Yeah, because it's a big topic.
Okay. So remember to follow us on Instagram and Facebook, B&B The Community MPs. Subscribe to our YouTube channel, B&B The Community MPs. And
remember that community is our beauty. Have a good day.